Welcome and thank you for joining us for today's session, Cubiko Billing Optimization. My name is Sydney Cruikshank and I'm from the PHN Education team. I'm joined today by my colleague Bonnie Finch, who is a Primary Care Practice Development Officer, and Christina Robinson, Head of Customer Success at Cubiko. Before we begin, I'd like to acknowledge the traditional custodians of the land that we live and work on. For myself on the Central Coast, that is Darkinjung country, and I'd also like to pay respect to elders past, present, and emerging. Now, a few things to let you know about this session. It will be recorded and available for you to view in our education library in a few days' time. As attendees, your camera and microphone are automatically disabled. However, if you have any questions throughout the presentation, please pop these through in the question box, which you will find located within your control panel. An evaluation will come to you directly after the session. Your feedback is extremely important as it enables us to provide future education. Now, it is my great pleasure to hand over to Bonnie Finch.
Thanks so much. Welcome to today's Cubiko session on maximising billing optimization, managing unbilled appointments, identifying missed payments, and leveraging these insights to optimize revenue while discovering strategies for addressing missed billings. Before we launch into today's session, though, I just wanted to take the opportunity to provide a little update on Savvy, our sustainability and viability initiative. Since launching in February of this year, we have had 60% of general practices across our region join Savvy and complete the viability assessment survey. The findings of this assessment afforded us some valuable insights into the challenges faced by our local general practices. One identified challenge was that some practices do not have the resources to invest in a health intelligence or analytics platform and are otherwise constrained from adopting a proactive business approach to business viability. Out of these findings, amongst other initiatives that we have going on, a partnership with Cubiko was formed. By collaborating with Cubiko and the development of a tailored sustainability support platform, we have been able to provide practices an opportunity to see their business's data in a new way and use its insights in a meaningful way. We hope that access and use of this platform will enable the general practice business sector across our region to strengthen and to thrive, and we thank you for joining us to achieve this. Now, I know Christina is going to show us some really incredible insights and functionality in our session today, so I'm excited and I won't delay us much more. But I just wanted to mention that if you don't yet have access to Cubiko or our sustainability support platform, I encourage you to submit an EOI for the 12-month funded license. While the licenses are mostly subscribed, we still have a few left available and are still accepting EOIs for a short time longer. So I definitely encourage you to take hold of this opportunity if you have not already. But with that, I want to thank you all for joining us today and let's get into the session. Thank you, Christina.
Great. Thanks, Bonnie. So hi everyone. Yes, I'm Christina, Head of Customer Success at Cubiko. So today is going to be the first in sort of a series of webinars that we're going to be running about how to use specific metrics in Cubiko around different topics and themes. So today is maximizing billing optimization with Cubiko. So Cubiko helps you get the most out of your data because we provide quick reporting. We have customizable dashboards that you can also share with your team. It's a data visualization tool and also a collaboration tool. And this means it can really help improve efficiencies in your practice and help you review your team workflows. So Cubiko is designed for your whole practice team. So definitely today's session is probably more practice manager focused, but you can provide access to Cubiko to specific metrics and data for your nursing, reception, and also your doctors. So today I'm going to be running through our billing optimization cabinet and managing your appointments. So looking at things like your uncompleted and unbilled appointments, after hours appointments that don't match the billings, prescribed pattern of services, your written off, deleted and cancelled reports and billings on hold. And then we're also going to look at your misbilling opportunities auditing metrics. So around specific item numbers where there's a potential missed billing and being able to see if that is something that you need to retrospectively bill with Medicare or DVA. Okay, so let's dive into our Cubiko dashboard. So I'm going to be using our demo data today to go through these metrics. So looking at the home page here, we're going to be focusing on the clinic optimization tab, looking at the billing optimization cabinet. So in here, this is where we're focusing a lot of the metrics that we're talking about today to make it nice and easy, going to one place. Again, you do have the option to add these to your favorites or a dashboard. So you can use the little three dots on any of the metrics to add to a dashboard or add to your favorites page. So you can do that for anything that we're showing here today. So getting started with the two key ones that if you're new to using Cubiko, we definitely want a practice to start using on a regular basis, which is uncompleted patient appointments and unbilled appointments. So they go hand in hand, and they're great auditing tools to ensure that your appointment book is billing all of the appointments appropriately. So looking at uncompleted patient appointments, this one is showing any appointment that is not marked as completed. So it might still have a status of waiting or with doctor or at billing. And these appointments are not marked as completed in your appointment book and not marked as did not attend. So these ones will need reviewed. When you first get Cubiko, when you're looking at this metric, it's a great idea to go back a full 2 years. So you can do that from our date range here. And we say 2 years because that's the current online claiming period. Again, if you want to go back further and do paper claiming with Medicare or DVA, you can, but generally we suggest 2 years as long as your practice has that billing data available. So if you're new to the practice management software system you're using, you may not have a full complete billing data for previous times. But using this, you can then use the date range on the calendar here to go back to a full 2 years worth. You can also use our preset date ranges on the left if you're wanting to do a smaller date range. So adjusting that to 2 years, you'll then get a full list of your uncompleted appointments. And these are focusing on your patient uncompleted appointments. There is actually a second table underneath, which is all uncompleted appointments. So what's the difference? In Cubiko, in our settings area, you have the ability to specify whether an appointment is actually a patient appointment or not a patient appointment. So there is a tick box option in here in your appointments to be able to say whether or not it's a patient appointment. So this would be a list of your appointments. And if you're wanting to record non-patient time in Cubiko, so something like meetings, training, anything that's basically paperwork or not patient facing, you can set up that appointment type to be showing as patient or non-patient time in Cubiko. So focusing mainly on the patient ones in the table, we're essentially wanting to go through and use this as an auditing tool. So once you've done the 2 years worth, you then will probably review this metric either weekly or monthly to make sure that all of the appointments are marked as completed in the appointment book and also processing any billings associated. So you can filter down by your appointment status. So we can look at the appointment types and we can also look at your appointment status. So if you wanted to focus first on any appointments that are at billing status, you can filter that down. You can download that list using our download arrow to then be able to print out and get your admin teams to ensure that the billing was processed. It could still be at billing status on the appointment book, even though the billing has been processed maybe through a different screen, through the patient file screen. So you want to make sure that the billing is there, or if there's no billing required, then also marking that as completed. So that becomes a bit of a workflow process for your reception team to ensure that all appointments are marked as completed. This is great for using for picking up when perhaps a practitioner might finalise the notes for a patient from the previous day on the current day. And so maybe no one's going back in the appointment book to have a look at that data. This will pick up any appointments that have been completed and put to billing by a practitioner, either on a different day or perhaps even outside of your standard appointment book hours. So it'll pick up anything and it will show it here where it is sitting for the appointment date and time. So making it easy to rectify. So once you've got your uncompleted patient appointments marked as completed and all actioned, they will then, if there is no invoice attached to a completed appointment, move into unbilled appointments. So unbilled appointments, again, is a great auditing tool. Again, suggesting go back the 2-year date range to start with, and then reviewing this one sort of on a weekly or monthly basis. So unbilled, these are all marked as completed in the appointment book, but they do not have an invoice that matches that appointment date. So when we're looking at appointment book data, you would have noticed in the previous uncompleted appointments, we are looking at your entire appointment book. So everybody who's included in your Cubiko data, which could be your doctors, your allied health, your specialists, and also your nursing team. So if you're wanting to focus on your doctors, use the role filter here to focus on your billing practitioners, where there would be a billing attached to that appointment. So you might want to select your allied health and your doctors. From there, that'll refine it down to looking at those role types, and you'll get your list of unbilled appointments. This is a really great one to sort of group together. You can sort any of the columns in Cubiko. So you might want to group the appointment types together. You might have a specific appointment type, such as removal of sutures, where you don't actually bill because it's part of your normal aftercare process. So there is no billing for that appointment. That'll make it easy to exclude them from the list. You can also filter down by appointment type. So if you wanted to remove any appointment types from the list, you can select all and then you can deselect the ones. Alternatively, you can select the ones you don't want. It's a little feature not many people use, selecting that, and then pressing invert will select the opposite. So that way I've excluded the 2 appointment types I don't need to look at. So that just makes it a little bit easier to run as an auditing tool. Again, you can download that spreadsheet and then work from that, whether you want to save it to your computer or you want to mark it, print it off. People like to work different ways, so making sure that you're running through those unbilled appointments on a regular basis. You can also look at your trend of unbilled appointments over time. This is a really great one to look at just in case there's an issue with training or new people starting at your practice. It could be a new doctor, it could be a new receptionist, and maybe there's a bit of a spike in unbilled appointments occurring around when they started. So maybe being able to provide a bit more training around how to process the appointments in the appointment book and ensuring that the billing is completed for those appointments. So that's uncompleted and unbilled appointments. The other one we have is after hours appointments do not match billing. So if your practice is open in the after hours period, and we're basing this on the standard definition from Medicare, so on a public holiday, on a Sunday, before 8 a.m. or after 1 p.m. on a Saturday, or before 8 a.m. or after 8 p.m. on any other weekday. So you can click here for more information around after hours attendances on Medicare website here. And this one is basically going to be looking at any appointment where it is started in the after hours period, so in those time frames, and the billing was not an after hours billing. So if it's blank, that's probably pretty good because the filters are already applied to this. We're looking for appointments where the billing doesn't match as an after hours item. It hasn't been paid, so it hasn't been paid by the patient and sent to Medicare for a rebate, or it hasn't been bulk billed to Medicare or DVA, allowing you to make changes. So if you are a practice that has regular after hours sessions, there's a few ways you can utilize this metric in your practice. So some of our practices have, for those times, ensured not to, if they're bulk billing the after hours consultations, making sure that they're not batching those to Medicare and DVA straight away and actually allowing them to sit overnight so that Cubiko can then extract the information from their server and show in this metric. And then they're able to come in and review. So you can change this to looking at yesterday, being able to review the data for any that are showing in here as not matching. If you wanted to, so you will see any in here and what they're being billed. So you'll see the time it was started as well. So we show both the appointment time and also the visit start time, because Cubiko can only pick it up based on time, but we will show when this visit started as well, in case you have any crossover times around the start of your after hours period or end of your after hours period. So what you'll be able to see is what was billed. So you might see in here that it was billed a 23 when it should have been a 50/20, and then you'll be able to see what dollar figure was actually missed between billing the standard consultation compared to the after hours consultation item. You can also filter down by practitioner, and you can apply some of the filters. If your payments have already gone through, you can tick the billings include batched invoices. So this will show you any items that have already been sent to Medicare or DVA. I might just try a longer date period to get a bit of data on the screen to make it easier to explain. Here we go. So this will include your batched. So we can see here in your invoice whether it's been batched or privately paid, or if it's not been sent. And then we can see what item numbers were billed. And then if there was any after hours opportunity based on the fact that we're saying it falls into this after hours category. And then you can go back and review the time of that appointment and also when the consultation began. So pressing that consultation start time that the practitioner will do. You can also filter it down by appointment type and also by certain hours. If you have different session colors in your appointment book, maybe for after hours, then you can actually filter down just to be looking at your after hours sessions, or perhaps you run an after hours clinic and you color code that in the appointment book. You can actually use our session type by color filter there to filter down to specific ones. So that'll just let you know if there was any that could have been billed. So I guess once you've already batched it or the patient has already paid for it, there's further paperwork that needs to be done to amend that. And it's really up to each practice if that's something you're wanting to do. It's also a great training tool though, so looking at if it is occurring that after hours billing isn't getting billed as an after hours item number, being able to again review that and provide additional training to your doctors and admin teams around after hours billing. So some other ones we have in here that are very popular for practices to review is your prescribed pattern of services. So looking at both your 80/20 rule and 30/20 rule. So within this metric, we have got a link to the Department of Health and Aged Care website where you can read more information about the rules and what item numbers are included in each of those rules. This is probably about the best one where I say, if you come into here and you have blank data, that is great, because that means that no practitioners have billed 80 or more services over the 20 days or in any day within the 12-month rolling date range. So similar for your 30/20 rule, which applies for your phone services. So looking at 30 or more phone services, and the auditing rule is 20 days. So what we've got in Cubiko is we will show you any single day where a practitioner may bill 80 or more services. So that may happen on occasion, especially if you're running, say, a flu clinic and they're providing a lot of services in one day and seeing a lot of patients in the flu clinic. So that may end up being more than 80 services on that day. So it'll start to list each individual day that a practitioner has more than 80 services. So that will help be able to provide discussion with the practitioner around that has occurred. Then we have a warning. So this one is your 15 to 20 days. So once they reach 15 days, it'll let you know how many doctors have reached 15 days here, and then any that have reached over the 20-day rule. So it's 20 days within a 12-month rolling period. So same with your 30/20 rule, set out pretty much the same. See each individual day that a practitioner has billed 30 or more phone services, and then if they've reached 15 days or more here, or 20 or more days, you'll have doctors showing in here. So then we have two metrics around your billings, looking at written off, deleted and cancelled. So this is a really great report for the management team to review, to be able to just ensure that anything that is being written off, deleted or cancelled in your invoices is being done appropriately. It is really good to be able to see who is writing off, deleting or cancelling, and then you can filter by the status as well. So if you wanted to look at just written off, you can filter down to that to ensure that your processes in your practice are being followed by your team, and being able to see what was written off as well. Then we have your billings on hold. I really like this one because it makes it nice and easy to see your held accounts. So being able to see the item numbers that are being put on hold. So there could be many reasons that you're putting invoices and billings on hold. So whether you're waiting on a Medicare card for a newborn, whether it's a care plan collaboration with Allied Health and you're waiting on that response, or whether it's you're waiting on histopathology to come back for some excisions and surgical items as well. So this will allow you to filter it down by practitioner. So you can filter by each doctor, and then you can download that list and provide it to that doctor to say, these are your held accounts. Have you got the item numbers for me to finalize this billing? So that will allow you to then ensure that you haven't got held accounts sitting there really old. Okay, so some other ones we have in Cubiko are historical opportunities. So these are really designed to help you ensure that you're getting paid for the work you're completing in your practice. So starting off with your historical 10997 opportunities. This metric is designed to be looking at any patient that is eligible for a 10997, so had a previous CDM billing, have not had their 5 billed at your practice for the current calendar year, and if they had an appointment with the nurse. So we're looking back historically here at the date range. You can review this one each week if that makes sense for your practice, and then having a look at what patients saw the nursing team and how many were eligible for a 10997. So this will give you a list of those patients, and it will tell you what the appointment type was and which nurse appointment book they were seeing. So it might be a specific nurse appointment book, it might be your treatment room, or one of your clinics that are running. And it's really about assessing whether or not there was opportunity for the 10997 service to be provided in your practice at that time. So looking at where the patient is spending time with your nursing team, was it appropriate with that appointment type that they booked in to also provide a 10997 service? So that's the first way to use it if you are trying to increase billing 10997 services in your practice, is where is that opportunity? So this is very opportunistic. The patient is already in your practice. They've actually come through to see the nurse. Was it something the nurse could have spent time performing at the same time as seeing them for the other issue? So working that out, having a discussion with your nursing team about where that can be increased in the practice. The second way to use this metric is once you're kind of set up in the flow of your nursing team billing, performing the 10997s on a regular basis, a lot of practices will set up a specific appointment type for 10997s and their 10987s to be able to then put it into their appointment book during the day. So if they're planning ahead for the current day or maybe even the next day, they might be putting in the appointments for those patients as a 10997 appointment type. Then if they complete that service, they mark that appointment as completed. If they don't complete the service, they can delete that appointment from their appointment book. Then you can use this auditing tool in Cubiko to be able to look at the previous day or the previous week and have a look to see if there was any 10997 appointment types, selecting from the list here, that saw a nurse and wasn't billed the 10997. So in essence, you would then be reviewing the patient file to ensure that it was documented, that it was completed by the nurse. But one of the reasons why to get the nurse to delete it from the appointment book if they didn't perform the service is to make it also a little bit quicker to review that. And then you'll be able to see here any appointments where the nurse has had a 10997 booked in with them for that patient, but the patient wasn't billed. So ensuring that completion circle of the doctor and the nurse and the reception team communicating and being able to bill for the 10997 performed. So it's a great little auditing tool to use that way as well to ensure that the billing has been completed for any 10997 services done by your nursing team. This is where you'll also find your previous 10997 completion rate. So if you have jumped into our item optimization cabinet yet, we do have a current calendar year 10997 completion tracker, and this will show you your 2 previous years. So you can see how previous years have gone compared to your current calendar year. So we've set up a similar metric for your 10987 opportunities. So again, instead of looking at your CDM and your additional nurse service as a 10997, this one is for your Aboriginal and Torres Strait Islander patients who have had a 715 health assessment, making them eligible for 10 10987s per calendar year. So again, this is looking at those patients who are then eligible for a 10987 who saw a nurse for an appointment but weren't billed a 10987. So again, disclaimer, we're not saying to go back and bill all of these in this list. You do need to ensure that the work was completed by the nurse. But again, looking at where opportunity lies for that to happen while the patient is in the practice, and then also setting up that appointment type so you can use it as an auditing tool in the future to ensure that you are billing those patients for the work done by the nursing team. So then we have set up 2 a round of vaccinations. We've got one for your flu vaccine and one for your COVID-19 appointments. They're both a little bit different. The first one, the historical flu vaccine opportunities, will allow you to, especially when you're doing your flu clinics earlier in the year, ensure that the billing is being done for the flu vaccines. So we have the first tab, which is flu vaccines with an invoice, which seems a little bit weird because we're looking at where there was an opportunity to make a billing. But this is done to essentially find those patients who should be charged a private flu vaccine fee. So we look at eligibility for flu vaccines in Cubiko based on the data we can find on the patient file, and we pop them into the categories where they are potentially eligible for a government-funded flu vaccine. So we can see here that if they're a child, they're eligible for government funded. And so when they had the flu vaccine recorded in their immunisation history, they're just being billed a consultation item number. If they're not eligible for government funded flus, remember this is demo data, so we'll go with this one here. They were given a flu vaccine on this date. It's recorded in their immunisation history. They're not eligible for government funded and they were only charged a consultation fee. So this might be where you would go into the patient file to see if they should have been billed a private flu vaccine fee as well, and be able to then review that and then raise that invoice for the patient to pay. If you are recording private flu vaccine fees, you will see them in here where it has occurred. You can also filter the list down. So if you're wanting to look only at those that are by Cubiko's definition, not eligible for government funded, we can click on the not eligible for government funded patients here. And then that flu vaccines with an invoice for not eligible for government funded will make it nice and easy to see whether or not that item has been put through. So you can also exclude items. So if you have a specific fee for private flu vax, you can select that from the list. I'm not sure if it exists in this one, in my demo data. No, but you can select it from the list and then it will remove any patients who have been billed that private flu vax, giving you the full list to then run the audit on to ensure your billing. Again, download and then work through that list. Download as a CSV, print it out, open it up in Excel, and then work through that list. The second tab is flu vaccines without an invoice. So this is basically anywhere, anytime on a patient file, an immunisation of a flu vaccine being given at the practice is recorded, but there is no invoice for that same date. So this is a really great one. You shouldn't have anyone in this list, I guess, other than potentially staff or friends or family or the doctors themselves, where you're receiving your immunisation as part of working at the practice. So you may have those kinds of patients listed here, but otherwise you're basically missing out that a fee has been charged for a patient receiving a vaccine at your practice and having the service provided. So this is a great one to use in conjunction with our flu vaccine support cabinet where you're running your flu clinics and being able to see that data in Cubiko as well. So this is supplementary for your flu clinics. The other one we created around unbilled vaccine appointments was COVID-19. This one's a little bit different because we are actually focusing on appointments. So we're not actually looking in the immunisation history here. We are looking if your COVID-19 appointment types do not have a billing for that service date. So they pretty much, it's like a refined list from your unbilled appointments metric, only looking at COVID-19 appointment types. So appointment types in Cubiko for COVID-19 need to be set up in your settings. So if you're in your settings and you're looking at your appointments again, we have another option across here for COVAX appointment. So you tick this for your appointment types you use specifically to book patients in for COVID-19. Again, it's maybe becoming a little bit less relevant, especially because you can combine your COVID and your flu vaccines together. But we definitely designed this metric during the pandemic, and it was extremely popular to be finding any unbilled COVID-19 appointments here. I will just make a little bit of a disclaimer because I know we have both best practice and medical director integration users within the PHN network, is that we don't have vaccine data for our medical director integrations. So we do have a restriction on getting clinical data around immunizations. So any metrics I'm showing here today, you may not have in your Cubiko dashboard, and that's purely just because of the integration type setup we have with medical director. If you do wish to see it as in the future, feel free to email our support team. We can send you an expression of interest for MD to further out our data extraction so that we can provide more clinical data for you in your dashboard as well. So looking at the other ones we have in here, these are opportunities that have passed and were definitely part of the pandemic area. So looking at 93666, which was your COVID-19 booster vaccination, it did cease on 1 February 2023. We've kept it in Cubiko because you do have 2 years to do your retrospective online claiming for patients. So again, it'll stay in here until February next year, when there is probably not very many more patients to action from this list, but it will be looking at immunisation history, looking at the COVID-19 vaccines, identifying it's a potential booster vaccine, and that there's no 93666 billed along with that date. So you'll have a list of patients here. If it's within the service date of the last 2 years, you can then double check that that was provided and be able to retrospectively bill that item to Medicare or DVA. The other one we have in here is the MT83 to 89, which was essentially your DVA patients who had a telehealth service were eligible to have a manually added incentive item added, which was either MT83, 84, 85, 86, 87, 88, 89, added depending on your modified Monash model area. There was only 2 to start with, MT88 and 89, and then they expanded it out to be all of the modified Monash model areas. So you need to know which one is appropriate for your location to be able to be billing. So again, this ceased on 1 November 2023, so it'll remain in Cubiko until the 2 years has passed. So you can review any patients where a DVA patient had a telehealth item billed, but did not have an MT item number added to their billing. So you should still be able to retrospectively bill that to DVA for patients that are eligible. Okay, well, that is looking at billing optimization today, looking at our different areas in the billing optimization cabinet and how to use those metrics more substantially in Cubiko. I think we're going to go to some questions now. So I'll throw to Bonnie to help me out with going through any questions and seeing if we can help you out and answer those.
That would be so fun to dive into all of that data and give us lots of work to do.
Bonnie, we can't hear you. I think your mic is.
No.
That's all
I've got
right.
it. Is that better? I'm so sorry.
Got it.
Here I was. Thank you so much for that and sharing all of those insights. I hope everybody has gotten excited about some of the data that they can find for their own practices. We don't have any questions as yet, so we would love to invite you now to add your questions into the chat, the Q&A box or the questions box. So if anyone has anything that they would like while they've got Christina on the line, front and center.
Yeah, that's it. Throw us some hard questions.
Yeah.
Get in while you can. But
Yeah.
we will be going through some different topics, so we'll be setting up some future webinars on different parts of Cubiko. So please keep an eye out for those as they come out and come along.
And Bonnie, I'll let you take that first question. And I'll just mention to everyone, instead of putting your hand up, please pop it in the question box because we are unable to unmute you. So please just pop your question in the question. But Bonnie, I'll let you go with the first question.
Yeah, excellent. So we've got a first question here from Taya. So you've mentioned to hold the after hours batching so that Cubiko can get the data overnight. So does Cubiko not work in real time?
Yeah, correct. So at this stage, Cubiko updates each night overnight. So you can see the date and timestamp at the bottom of your screen. So we can see here that it was done anytime from late evening. It'll be outside of your business hours to ensure that it isn't putting a drain on your practice management system while your doctors are using it. So at this stage, we just do overnight extraction. So exactly to see any of today's billings, you'll need to wait till tonight to review that tomorrow.
Excellent. Thank you. We've also got a question from Sarah. Does the 10997 10987 billing check also look for the telephone and video telehealth item equivalents?
Yes, it does. Anytime we sort of talk about an item number in Cubico, we are always including the equivalent telehealth, telephone, and non-VR item numbers as well.
Excellent. And Katie, yes, this session is being recorded and will be available in our education library following in a couple of days' time. Excellent. Got any more questions coming through?
I love waiting on the typing.
Yeah.
You should have a little ellipsis where we can see that someone's typing.
Yeah, so we don't miss anybody.
Perfect. Well, no more questions have come in, so we may wrap it up here for today, but please, the evaluation will come to you directly after. And if you think of anything, you can also include the question in there, and I will email it directly to Christina. Bonnie, thank you for your time as well, and looking forward to some more sessions in the future.
That's great. Thanks, everyone.
Thanks so much for having us.